So thank you to IP.Global for this opportunity to share our experiences of learning in lockdown. So we're members of the IPE Experience Research Subgroup at the UK-based charity CAPE, which is the Centre for the Advancement of Interprofessional Education, and it's the leading organisation in the UK for IPE and collaborative practice. So the group has a global membership with colleagues from England, Scotland, Wales, the Philippines, Qatar, Rwanda and Sri Lanka. Speakers for today's presentation hail from England, Scotland and the Philippines, with colleagues who contributed to the series of articles in the audience who would be keen to participate in the post-presentation discussion. So this presentation will focus on the first 4 articles in a series of 8. And they've been published in the British Journal of Midwifery. Vikki will give an overview of the introductory article. Lisa will then go on to talk about the impact of COVID-19 on the delivery of IPE, and then Mike and Melissa will talk about students' and academics' experiences respectively. Finally, Veronica will briefly introduce the final 4 articles we hope to share in a future presentation, and then pose some trigger questions for discussion.
Thank you, Alison. So the first article in the series was produced by 16 authors from CAPE's Research Working Subgroup, and we do focus on interprofessional education experiences. The series of papers explore the impact of COVID-19 pandemic on interprofessional education provision across the world, and the first paper serves as an introduction. So it outlines the context and the purpose for the series of papers, and it highlights the contents in forthcoming articles. What you can see on the screen is an infographic that was produced by Interprofessional.Global, and they converted the key pedagogical practice and policy implications from the first article that was published. This was disseminated internationally across social media platforms and within their website as part of their IPR Pearls initiative. Pedagogically, the paper purports that learning with technology promoted interprofessional learning of students and academic staff. And with respect to practice, the paper acknowledges the role that technology played whilst we converted IPE provision using emergency remote teaching methods because of the pandemic. In terms of policy, the mandate for interprofessional education for those of us educating professionals who are registered with professional bodies had to continue. Therefore, because IPE is regarded as key to preparing students who are on health and social care programmes, so that students can work effectively in interprofessional teams, the series of articles that we've produced explores experiences from multiple perspectives, from the perspectives of academics, students, and users of services, and this is delivered from a global perspective. So the perceptions and attitudes of academic students and service users on such comprehensive changes are unique and offer a rich data source to explore and to inform future provision. And now I'd like to hand over to Sarah.
Thank you, Vikki, and thank you for the opportunity to share our findings with you. In the second article in this paper, we gathered experiences with delivery process of IPE during the COVID-19 pandemic. So what we mean by process is that involves planning and delivering of IPE. It consists of the teaching and the learning approaches, such as the distance learning or the facilitation style. So what was the key factor that changed? All face-to-face learning went to online teaching and learning, and that affected other factors of the delivery process, such as, for example, the mix of students or the duration of IPE sessions, the learning activities applied, or the facilitation skills facilitators needed. Remote learning and teaching is very challenging in terms of ensuring that the students learn the same thing as face-to-face. However, in our case studies, the people highlighted the flexibility with online learning and teaching as an essential point and advantage of online learning. However, virtual encounters with students from other healthcare professionals are not perceived as sustainable as face-to-face encounters, and additional considerations must be given to the duration of IPE. In our case studies, we highlighted that Online learning was mostly shorter than face-to-face sessions, but at the same time, it was more time-consuming in terms of preparation in the beginning. Our case studies mentioned also students and facilitators' differing levels of digital competencies. And whilst there was support for the facilitators technologically, students had to independently adapt to their new learning environment and new learning tools. This can increase accessibility problems for students. So these were the main challenges and barriers and opportunities of the delivery process of IPE during COVID-19. And I'm happy to hand over to Mike now.
Thank you for that, Lisa. At this point, I will be discussing the third article, which focuses on the experiences of students from different contexts and different countries regarding the emergence of remote teaching for IPE. And this is also connected to the next article, the fourth article, which will be discussing the faculty experiences. For the third article, we have three key takeaways, and they are the opportunity to co-design with students, sensitivity for equity when it comes to learning and teaching resources, and having a supportive environment. First, I'd like to discuss opportunity to co-design with students, because this is often the most or more or less neglected part in terms of instructional designing. And in our article, based on the case studies that we've created or we've drafted, we found that it is very important that we include our students in designing their learning experience as well, especially when it comes to online IPE courses, to make sure that they have more engagements, interactions, and that their learning is well guided. The second takeaway that we have for this article is really the sensitivity to their learner characteristics, and that includes their learning needs, at the same time their work priorities in cases of adult learners, because in one of our case studies we discussed IPE courses taken by postgraduate students who are also clinicians and teachers in the different health professions. We also need to consider age, their digital literacies, and at the same time their own resources, because we found that in the UK and outside the United Kingdom, we have seen that there are students who might not have access to good internet connections, or some students might not have a laptop to continue their studies. So these are the things that we need to be very mindful of as educators, to really look into the learner's characteristics. And lastly, the takeaway that we found in this article is really the supportive environment that we should provide in our IPE courses and even in other health science related courses. It is important to make sure that we give them guided feedback and intentional support by providing them with feed-forward strategies. It is not enough that we just give them feedback to point out what's missing or where they need to improve on, but really telling them what to do next so that they can really make sure that they are learning and that they are also enjoying their learning experience. So that's all for Article 3. Now we move on to Article 4. Melissa?
Thanks, Mike. Okay, so in this paper we actually focused on the academics and their experiences of changing to an emergency rate teaching during lockdown. The paper was written by 4 colleagues, 3 of us from England and 1 from the Philippines, and it took a reflective approach. One thing that we found is that we actively require our students to reflect, but as academics sometimes we need to be reminded to stop, and just to reflect on our own experiences and consider how we can develop and build on them. And this gave us the opportunity, platform to do so. So in the paper, we discussed the trials and the challenges that academics faced in moving to emergency remote teaching. This included the what and how these were overcome to ensure high quality IPE was still able to be delivered. The challenge of moving quickly is that we don't always have the preparation that we would normally have. We had to learn new technology. We had to overcome virtual barriers. And so giving us the opportunity to reflect meant that we could actually look back on how we managed to achieve that, what the benefits were, what the positives were, some of the things that we could learn. And then we were able to move on to the now what, to consider what we do next, how we maintain those. And finally, we added an additional element to Bob's model, which was the then what, where we looked at how can we actually sustain what we've developed, what can we use to take forward to our future teachings in order to ensure that we continue to promote and sustain positive interprofessional education activities for all. Thank you. I'm now going to hand over to Veronica.
Thanks, Alissa. So you've heard from colleagues today about the articles that have been published, and we're pleased to say that there are more to come. So more coming soon, including Article 5, which is based on and focused on practice-based learning, and that's actually in press at the moment, so coming very, very soon with that one. And although the previous articles have touched on IPE that's happened and the adaptations that have had to happen, COVID-19, this article really focuses on the impact within that practice learning environment. Article 6 focuses on the assessments during the pandemic and looks at how organisations have had to change and adapt their assessment methods to ensure that they're continuing to assess students into professional learning. Article 7 will focus on the service users' experiences and some of the changes that have had to happen throughout the COVID-19 pandemic, which have impacted on our ability to engage service users in interprofessional education. And Article 8 will really provide a sum-up of the lessons that have been learned, and hopefully we'll be able to generate some top tips that will help educators and interprofessional coordinators and facilitators in the future. And then just moving on to the next slide there is really just to end this presentation and pass back to you to consider some of these important reflections and points for discussion. So you've heard from us and some of the cases that we've been able to report on in terms of faculty experiences, student experiences, and service user experiences of the impact of COVID-19 on interprofessional education. And some of this may have resonated with you, some of the things that have been discussed may resonate with you. Some of them may be very different to your experiences. And really this is just for you to consider and think back what has happened in your experience in terms of the mode of delivery, in terms of the student's experience, academic experience, and service user as well, which will have come up through these articles. The final slide is references to the publications in the British Journal of Midwifery, and we'd be happy if anybody listening today wanted to contact any of the CAPE research group to discuss anything further. But thank you very much for listening today.